One of the most common heart rhythm disorders is atrial fibrillation, commonly referred to as AFib. While many people have heard of this arrhythmia, few know what it means, who it affects, and how to correct the rhythm problem. Joining me today with some answers is Mount Carmel cardiologist Dr. Kevin Hackett. Dr. Hackett, so nice to have you here.
Thanks for having me.
Let's talk about this atrial fibrillation, which people know the term, have heard of it. In layman's terms, how would you describe it?
Well, atrial fibrillation is there's two upper chambers and two lower chambers of the heart. And normally they work in synchrony. But when people go into atrial fibrillation, the upper chambers beat chaotically. So it gives the patient an irregular heart rhythm, or irregular heartbeat and pulse. It oftentimes results in shortness of breath for people, fatigue, chest pain. Though quite frankly, some people are completely asymptomatic with it.
They don't feel it at all.
No, I mean, there's a proportion of people that will walk into our office that have seen their physician for another reason and noted to be an atrial fibrillation, and they walk in and are surprised to find out that there's a problem.
Wow. You said some symptoms are shortness of breath. Some people don't have symptoms at all.
Correct.
But more often than not, these people that do have these symptoms, can you correct it, especially if they are suffering with those symptoms?
Oh, absolutely. And the patients that are symptomatic for certain, one of the first things we initially will do is determine what their heart looks like structurally. So we'll do some testing to see, are there any valvular abnormalities? Is their heart pump function normal? Are their chambers enlarged? Once that's been done, then we will initiate a treatment program for them that would be best suited for them. One of the other considerations in most people is the possibility or the risk of stroke. And so we always assess that as well to make a determination whether blood thinners might be needed in those patients.
How common is it? I know it is a common arrhythmia, but how common?
Well, 2.5 million Americans have atrial fibrillation, Gail,
really?
and it is a disease that increases in frequency with age, unfortunately. Above the age of 80, 9 to 10% of people have atrial fibrillation. Under the age of 50, it's only about 0.1 to 0.2%, but it's a linear progression as patients get older.
How worried should people be if they have this, and how important is it that they take action to get it corrected?
Well, it's important that you see a physician and be evaluated for it because of the issues we had discussed just briefly earlier, which is the issue of stroke. Obviously, it is not a life-threatening problem for the majority of people, but obviously we don't want people going on to progress to have a stroke or have other cardiovascular complications as a result of atrial fibrillation if it can be treated easily.
So how can it be treated easily? Well,
and the initial treatment for the majority of patients is blood thinners if required or some sort of a rhythm controlling medication. About 30 to 40% of people we can control on a medication. One of the things, though, I caution patients when I see them the first time is, though, you may initially be well controlled with medication, but as time progresses and the disease itself that may be predisposing you to it progresses, it may not work long term.
It's interesting. I have atrial fibrillation, which has been corrected, at least now. I know it can come back, though, right?
Absolutely. The common thing we tell people have atrial fibrillation, we'll have atrial fibrillation again.
It's something that just happens in life.
Correct. And the good thing is you're not going to die from it, but it can be life-altering for people. So it's important that you establish with a physician that has an understanding of atrial fibrillation and its treatment, get appropriate therapy to begin with, and then be followed for it longitudinally so that if problems recur down the road, those can be addressed rapidly.
My symptoms were I found it hard to breathe, and I attributed it to not getting enough exercise. I need to walk faster. I need to walk farther. But that is a big symptom for folks that if they clicked it on, and they usually are fine, that all of a sudden heavy breathing means you have a problem.
Right. I mean, we have a lot of people that are in your age group that would come in and they just think they're getting out of shape.
That's exactly it.
We find out that they're actually in an abnormal heart rhythm, and they're shocked to find that out. Then, as you know, oftentimes they'll go on to require a shock to restore the normal rhythm or some sort of a medication to restore the normal rhythm.
So there are levels that you can take to help these folks.
Absolutely. One of the things that we have found is that in patients that are completely asymptomatic, if you just control the rate if they're in atrial fibrillation all the time and treat them with blood thinners if they require that, then their longevity will not be impacted, and obviously their quality of life will not be impacted.
Which is important, too. There is so much more we could talk about this, and you will, at a free seminar sponsored by Mount Carmel Hospitals. It's going to be on atrial fibrillation, and the seminar will be at the Upper Arlington Public Library, Dr. Hackett is going to be your speaker at 10:30. That's Wednesday, March 28th. And we want to make sure that while we say it's free, Dr. Hackett, it is important to register because there's a phone number there, and there are people that will be turned away, unfortunately, if they don't. Right?
Correct.
You've been to enough of these, and you've spoken to these that
it is such a
crowded.
It is such a common problem, and people have a lot of questions. While it's fortunately not life-threatening, it's a complicated issue, and each patient is different in the way you would decide what to do with them. So it is not quite so straightforward, and we have patients all the time that say, hey, my friend had this, this, and this, and we tell them that doesn't work for you, and here's why. And
you're different.
And you're different.
Well, you can speak to all those issues at the seminar again. That's Wednesday, March 28th. Thanks, Dr. Hackett.
Thanks, Gail.